Learning on the fly is a skill as nurses that we need to be able to learn, be able to quickly and effectively apply in order to best take care of our patients. Today, I decided to talk about the disease process, diabetic ketoacidosis, and also how it impacts obstetric patients. In diabetic ketoacidosis, that disease process is a process where there's essentially no insulin within our bloodstream or our bodies. We need insulin in order to transport glucose into our cells, which is then utilized as fuel and energy for our bodies. When insulin isn't available, our body resorts to alternative processes in order to get the fuel and the energy that it needs. When you have a patient that is experiencing diabetic ketoacidosis, the patient is hyperglycemic, meaning they have excess glucose within their bloodstream. The liver is impacted by this. Oftentimes the liver will recognize the low fuel and energy, and in turn release glucagon stores that it has in place, which further exacerbates the diabetic ketoacidosis disease process and also the hyperglycemia. Another function or another organ within the body that's impacted is the kidneys. When we have excess glucose in our bloodstream, our kidneys cannot reabsorb that excess glucose. So we start to have leaking within the renal tubules. We start to experience osmotic diuresis, meaning the water and the fluid in our bodies are going to gravitate to a higher degree of concentration, which is outside of the cell. So with that, we're losing a lot of fluids. We're also losing electrolytes as well, which also causes other issues within our bodies. Another issue that we experience with diabetic ketoacidosis patients is ketones. Ketones are released. Ketones are basically a byproduct of fat cells. They can be utilized as an alternative for fuel and for energy. However, it does have negative impacts as well. The ketones that are broken down cause ketoacidosis, causing metabolic imbalances within the body. Learning tools that I feel like are important to utilize when learning on the fly to care for my patient would include a couple of things. First being scholarly peer-reviewed articles. I've listed a couple here within my citations. I also use audio-visual sources that I've also added in my citations. And then lastly, Grady policies and procedures. I feel like it's important to make sure that if I, am inquisitive, I have questions, I'm curious about how disease processes work, and I want to make sure that I'm best informed that these learning tools will best help me to do that. Some of the causes of diabetic ketoacidosis include the fact that some patients may not know that they have diabetes. So this episode with diabetic ketoacidosis would be the first episode and lead to a diagnosis of diabetes. Another cause is non-compliance to a diabetes regimen. So if you have a patient that has already been diagnosed with diabetes, but they are not taking their insulin appropriately or medication appropriately, that can be a factor as well. And then lastly, illness, stress, hormonal changes in pregnancy, those are factors also that play a part in diabetic ketoacidosis developing. Some of the signs and symptoms would include polyuria. Like I said before, because of the impact on the kidneys, you'll start to have patients urinating more. Polydipsia, because they're losing a lot of fluid, they'll be drinking more. Dehydration, of course, because of, again, the fluid loss and then also the loss of electrolytes. All of those things contribute to that. Also, nausea, vomiting, and abdominal pain are signs and symptoms as well. Per my articles that I reviewed, there's some special considerations as well to mention as far as diabetic ketoacidosis and the obstetric patient. The altered metabolic environment of human pregnancy means that diabetic ketoacidosis can develop more quickly and in the context of less severe hypoglycemia. So with that being said, that basically means it doesn't take that much for a pregnant woman or obstetric patient to find themselves in a condition of diabetic ketoacidosis. Also, pregnancy is considered a state of accelerated starvation with enhanced lipolysis and ketone body production, even with relatively short periods of starvation or fasting. So again, that accelerates the process of metabolic imbalances within the body, which also push the patient at risk. Diabetic ketoacidosis during pregnancy is associated with high rates of pregnancy loss and considerable maternal and neonatal morbidity, meaning the patient and baby can have long-lasting effects if diabetic ketoacidosis is not remedied. Women who present with diabetic ketoacidosis are frequently from a lower social economic status. We have a population of patients that also have those challenges, which is why it's also important to make sure that we provide them with the resources and the education that they need to make sure that they have optimal outcomes. They typically have suboptimal glucose control before and after pregnancy. That's cited from the Journal of Clinical Endocrinology and Metabolism. Also too, diabetic ketoacidosis in pregnant women can include fetal acidosis with abnormal fetal heart rates. So that's another metric that is particular or specific to obstetric patients dealing with this disease process, that's cited within the International Journal of Gynecology. Some of the nursing priorities that I feel are important would be to review the provider orders, ask clarifying questions if needed. It's very important to make sure that we understand the order prior to administering any medication, using the 5 rights of medication, making sure that we're administering it to the right patient, the right medication, the right time, and the right dosage. We want to make sure that we monitor the complete metabolic panels. We want to make sure we also monitor the chemistry lab values as well. If we see something abnormal, we want to make sure that we're notifying the provider. And then lastly, patient education. Patient education is vitally important because if we can be proactive instead of being reactive, and also empower our patients with knowledge, we can oftentimes ward off situations that become a lot more severe before that happens. Some of the patient care modifications that I think are important would be frequent blood glucose checks. Oftentimes the glucose checks are going to be what is the driving factor as far as the insulin administration, and what needs to, what dosage needs to be administered to the patient. We want to make sure that we maintain adequate hydration to counteract the fluid loss that the patient is experiencing, and also any electrolyte imbalances that they may have. Electronic fetal monitoring is important because, as stated, the baby can also experience metabolic acidosis due to the diabetic ketoacidosis causing morbidities within baby. So we want to just keep a status on what's going on in utero as well. We want to make sure that we verify and implement the diet and intake orders. Oftentimes, diabetic patients will have either an ADA diet, or if they find themselves within the disease process of diabetic ketoacidosis, they may be NPO depending on the provider order. Lastly, we want to monitor for signs and symptoms of diabetic ketoacidosis exacerbation. Some of the goals would be to, again, educate our patients that are at risk, be proactive with early diagnosis, and optimal outcomes for our moms and babies. Thank you.